Can you hear me? I can't hear you because you're muted.
Yes, I can hear you.
Oh, there we go.
Hi.
How's it going?
Hey.
Is that
Congressman? We are going to go ahead and get started. Thanks to everybody who's on so far. And thank you so much, Congressman, for joining us today. Let's see. Okay, I'm just going to make sure everyone else is muted. Here we go. Great. So thanks everybody for joining us today. I'm Delegate Brooke Learman, and I represent, along with my teammates, Senator Bill Ferguson, Delegate Robin Lewis, and Luke Clippinger, the 46th district in Baltimore City, though of course we work at the state level to pass and implement policies that affect the entire state. And welcome to the second webinar that I'm hosting to help connect you with policymakers and experts. I'm so pleased today to have the Congressman from Maryland's 3rd Congressional District with us, John Sarbanes. Before we begin, I just want to make a few points about where we are and why I'm hosting these webinars. So for all of you who know me, you know this, but for those guests who haven't seen me before, I have long believed that being an elected official and being a delegate is more than about just passing bills and it's also about connecting people to the resources that they need. And I fundamentally believe that government should be about reducing barriers to success and creating opportunity and keeping residents safe. And as we find ourselves in the midst of the greatest public health crisis in the last 100 years with unemployment filings that have far surpassed any filings in my lifetime, we're in uncharted territory. Everyone is hurting in some way. And now that the federal and state governments have passed some measures to help, I want to make sure that you know and others know what those measures are and how to access the help that you need. So this past Monday, we hosted a webinar with the Maryland Cash Campaign and the Homeless Persons Representation Project. You can find that on my YouTube video. Today, I'm so pleased to have my very own congressman here today. So just quick remarks about where we are at the state level and local level, and then I'm going to turn it over to Congressman Sarbanes. So today at the state level, we find ourselves with over 4,300 confirmed cases of COVID-19 here in Maryland, over 100 who've died from the disease and more than 1,100 in hospitals. Governor Hogan has issued many executive orders, including a stay-at-home directive. We've closed non-essential businesses, expanded telehealth services, and prohibited residential, commercial, and industrial evictions. Just yesterday, the Department of Commerce stopped taking new emergency loan applications after receiving more than 40,000 applications and simply running out of funds. So during the last week of March, nearly 42,000 Marylanders applied for unemployment. In Baltimore, we're working at the local level to create a streamlined healthcare system. We have now in place, the mayor has put in place a public-private partnership to streamline our healthcare system. And we're working to support the food needs and housing needs, as well as our small businesses. But there is so much more to do. I was on a call today trying to make sure that we're filling the gaps for all of our residents, including our undocumented residents, have no access to federal help at this point, to make sure that they are not going hungry and have as well. So that's where we are at the state and local level. To discuss what the federal government has been doing and to give us more information about the just passed last week, the CARES Act, but also on what's to come, I'm going to turn it over to Congressman Sarbanes, who will introduce himself, discuss the federal response to COVID-19, including the CARES Act, and talk about what he sees as additional response efforts to provide some economic relief to Marylanders and to keep our communities safe. And then we're gonna, I have a number of questions that folks sent in, and if we have time, we'll get to your questions in the chat window as well. So thank you so much for joining me today, and I'm going to turn it over to you, Congressman Sarbanes. Thank you.
well, thanks. Thanks very much, Brooke. I appreciate it very much. Not just the opportunity to be on the call with you today, but all that you're doing to try to be a trusted source of information for your constituents. I think we're all trying to play that role at a very critical time. And it can be tough because there's a lot of information that is bombarding people every single day. So having those trusted sources of information, I think, is really important. I want to thank you in your capacity as a legislator for what the Maryland General Assembly did to lean in and provide some real relief for Marylanders in the midst of this pandemic. Obviously, we're trying to do the same thing at the federal level. I want to begin first and foremost by saluting people out there who are taking these precautions. All of us can social distance if we're not performing an essential activity, and we certainly need to do that and take all the precautions that we're being told to take by the public health officials. Those are the folks that I take my cues from right now, as do you. And of course, we salute those who are in these essential jobs, the frontline workers, healthcare workers, the food delivery people, first responders, and so forth, who are leaving their houses every day and going to the front lines to keep us safe. And we just have so much humility in the face of what they're doing. So we want to thank them for that good work. We have been trying to move as quickly as possible in Washington to respond not just to the public health crisis, but to the huge economic dislocation that people are experiencing. And the most sort of, I guess, robust response that we've had was the CARES Act, which we passed about 2 weeks ago, was a $2.2 trillion stimulus bill to try to address what's happening to our economy, but also get needed resources to the healthcare providers out there. Just in broad strokes, some of the things that it did, and I know we'll talk more about this in the Q&A exchange, but it brought about $100 billion to healthcare providers, hospitals, and other healthcare providers across the country, who obviously are the ones that are handling this crisis front and center. That went to all kinds of things, including the important element of protective equipment for these hospitals. We'll talk a little bit later probably about some of the challenges that are being faced just in finding those supplies and getting them to where they need to be, but substantial support for healthcare providers out there. $150 billion to flow to states and local governments of a certain size. So for example, there was a cutoff for municipalities of 500,000 people or more. Baltimore City clearly qualifies for that. And I think there's about, I just looked at, I think about $103 million estimated to be coming to Baltimore City from that first tranche that was included in the CARES Act. So getting money out to state and local governments, which are obviously in dire need right now. Direct payments to families out there and individuals that will begin to flow within the next week. Unemployment insurance benefits expanded and extended. That's a very important thing, and I hope we'll talk a little bit more about the details of that. Support for small businesses, which is critical, and helping them maintain connections with their workforce. So maybe they don't have to let go of people in this very difficult time. And then we've also got some support for larger businesses and industries out there that have been impacted by the coronavirus. So there's a number of different ways that we're trying to stabilize the economy through the CARES Act. We don't expect this to be the last intervention by any means, and we're already starting to think about what would come next in terms of providing that ongoing stability. But it was a pretty robust response. I will say this, because I can anticipate what some of the questions will be. There's a lot of money that's been authorized and appropriated. The challenge is the mechanics of getting it out the door and getting it to the people who need it, whether that's small businesses or nonprofits or organizations, or whether it's individuals and families. And there's going to be a lot of impatience and anxiety around that. The system's not designed to put those sorts of dollars out as quickly and at the scale we're doing it. So there are going to be glitches. But I know people are trying to work through those that are in the various agencies that administer this, and we're going to try to get those resources to people as quickly as we can. Again, thank you for the opportunity to participate today and to share good information with you.
Yeah, no, well, thank you. That's really helpful information. And I think you're right. You know, a number of people have had questions about state programs, and of course, unemployment flows through the state. So it's important for people to know. And there is and if people want to email me about unemployment concerns or the unemployment office, that's, you know, we're fielding those calls and happy to keep working on them. Can you talk a little bit about, there were a couple of questions about the $1,200 payments.
Yeah.
And one question in particular, will the $1,200 in direct payments in essence be a grant and not taken against future taxes to be paid back? Is this direct payment going to be considered taxable income for low-income individuals and those on disability? Could you talk a little bit about that?
That's a good question. This is structured as a rebate, so it in a sense serves as like a grant. It's not going to impact either future eligibility for other programs that are based on your taxable status. It will not be taxed as federal income. So in that sense, when you have it, it's all available to you to be used. It's $1,200, as you know, for a single individual, up to $2,400 for joint filers, and then there's a $500 payment that's available for child dependents who are 17 years or younger. So a family of 4 that has 2 dependent children could qualify for $3,400 in payments. Those who file tax returns and have direct deposits will be the first recipients, because that's the fastest way to get this out. By mid-April, 60 million people will be receiving direct payments in that fashion. Going forward, in terms of cutting checks, there will be 5 million sent out each week, but beginning with those at the lower end of the income scale, so the people who need those resources the most are getting them sooner rather than later.
That makes sense. That makes sense. And I have to ask before we go on, where are you? Where are you? You have all
I'm
these
in my basement.
background.
Yeah. We've got 4 adults living here, my wife and I and 2 children, and we've sort of parceled out the premises, and I got the basement room where I've had a sort of home office in the past. So yeah, I got a lot of boxes there and some upside down chairs and other kinds of things. So we're all doing what we can.
I appreciate that. We took over my kids' playroom, and my husband, I just kicked him out for an hour so I could do this webinar, and he's now up in our bedroom. So, and if you hear any little voices, it's my children. Right. We're experimenting and doing the online distance learning now too, because my son's in 1st grade. So, you know, it's hard. It's a lot of work, but I'm glad Baltimore City Public Schools is doing a great job, and the teachers are doing a really phenomenal job, you know, trying to connect with their kids. So it's been good. So a couple other questions. There was one question about school systems actually, and can the federal government provide more resources to school systems where students don't have access to tablets, laptops, high-speed internet? I will just tell you personally, you know, we are lucky to have access, so my son has access, but I think, you know, one of the things we've seen is that even if we can get kids a Chromebook, you know, we're reliant on the Comcasts of the world to make sure that they have access to internet. And it has made me start thinking about, you know, maybe internet really should be a public good. But I'm curious to hear your reaction on how the federal government is supporting school systems.
Well, just on your last point, Brooke, I'm very sympathetic. There's certain things that everybody needs and ought to be subject to real regulation, and there's good arguments that those sorts of things ought to be regulated like public utilities. And I think you can certainly make arguments when you're talking about access to Wi-Fi and to the internet and so forth. Yeah. Having said that, the CARES Act did include about $13 billion to flow to support K through 12 programming and efforts around the country that have been impacted, obviously, by the COVID-19 outbreak. I think Maryland stands to see about $200 million coming in for that. That will go to things like distance learning training, technology support for educators and students, et cetera, particularly some additional funds coming towards students with disabilities. So there was a recognition that, again, as part of this mitigation strategy that's being broadly deployed across our country, that there was going to be disruption. Students are now home, but we want to maintain the educational opportunities for them. So putting support behind that is critical. In terms of making broadband more available and just building out the infrastructure so that no one gets left behind when it comes to accessing these remote learning opportunities, that's not part of the initial CARES Act. It is something that we've talked about potentially adding to another round of support in the face of this pandemic. So a number of members are speaking to that. I certainly am an advocate for that because it's directly related to the crisis we're in right now. So we'll continue to push for that.
That's great. Thank you. I think another aspect that we've all been dealing with, and certainly in District 46, we have, hundreds of small businesses, some of them sole proprietors, toy stores, restaurants, bars, but then, retailers, small manufacturers, startups. And could you talk a little bit about the PPP and what the CARES Act, how you envision it working, and what you're hearing, because there have been some concerns because it's administered through banks, right? And so if you could talk a little bit about what you're hearing and what your office is doing to, to help get this program off the ground, that would be great.
Right. This is an absolutely critical program. In fact, so critical that I expect that very soon we will be putting additional monies into the program because there's a recognition of the need across the country among small businesses, but also the idea that if you can create a way for these small businesses to maintain connections with their employees, that when it comes time for us to begin exiting this crisis and ramping the economy back up, we're in a much stronger position to do that more quickly if those connections and relationships have been preserved. So what the Small Business Administration is doing now is administering a $350 billion program called the Paycheck Protection Program, which offers loans that can go up to $10 million to businesses, and this includes also, by the way, nonprofit organizations.
Yep.
With employees, 500 employees or less. And the idea is that if you make a commitment to keep your payroll essentially where it's been, keep your employees on the payroll at the level where they were before COVID hit, then a significant portion of what starts as a loan will be forgiven. So in a sense, it turns into a grant if you're doing the right thing. So it's an incentive-based program to encourage businesses to maintain those connections with their employees. Now, it also has added opportunities for gig workers, for independent contractors, for others that might not normally have qualified for this kind of loan support from the Small Business Administration. So to the extent those additional pieces are being added, some of the guidance there hasn't been fully fleshed out yet. But there's a lot of applications coming into SBA. They are processing them as quickly as they can. Now, having said that, there's going to be slowdowns in this system because the SBA is now administering, in terms of loans, as much in one day, about $30 billion worth of these loans, as they normally do in a year. And so just thinking about what that represents in terms of the crush of interest and applications is sort of breathtaking. To your last point, some of the banks are being cautious about participating in this because they're nervous about what some of the requirements are and whether they could be caught out later if they haven't sort of put people through certain paces and so forth. Those are being worked through. But again, we ask people to be patient. As hard as it is, the dollars will get there. Ultimately, we're going to push them as hard as we can. But the system right now, is, as you can imagine, is very burdened by the interest and expectation.
Yeah, no, absolutely. I think, people on Friday and Saturday were emailing me about this, and it's an incredibly important program. So thanks for working on it. But yeah, it's got growing pains, you know, as
I do want to
anything.
let me mention one other program because this is important too. There's something called economic injury disaster loans, which is an existing program where you can get up to $2 million of support, including a $10,000 advance payment if you basically put in an initial application, and that advance is awarded regardless of whether you ultimately receive the full loan. That's another opportunity that many businesses can access under these circumstances. And so any listener who's a small business or is connected to one who wants to get more information on this, they ought to go to the Baltimore District of SBA. They can come to my office, they can come to my website, and they'll get more information about that. You as well, obviously, have deployed a lot of important resources on this.
That's helpful. Thank you. So now if you could just talk a little bit, there are questions about what's next, you know, and what, you know, it's sort of, I would say $64,000 question, but it's probably going to be worth a lot more than that. So what are you thinking, or what are you hearing, or, you know, infrastructure support for cities and states? You know, Baltimore City is looking at now $45 million deficit after we were going to be running a $25 million surplus. You know, I'm just curious what are folks talking about in terms of, and what do you think in terms of, you know, what's next for the federal government to do?
Yeah, I think there's two major categories we can talk to. One is what I referred to earlier on, which is all these supports that we've put in place are only going to last but so long. I mean, even though it was a $2.2 trillion stimulus package, that's not going to get you through the end of this crisis. So to the extent we've identified ways of getting important funding out the door, whether it's for individuals through the direct payments and the unemployment insurance, or whether it's through small businesses, through these new programs that have been created at the SBA, those dollars are going to get used up relatively quickly. And so so I think in terms of what comes next, one thing is just continuing to replenish these funds so that people that are in need and qualify and are eligible can get those dollars. So it's not a kind of you lost out because you weren't on the front end of it. There will be dollars for everybody who needs it. So that's certainly a discussion that's happening. And in fact, even before we get to designing a new CARES Act, we're calling CARES 2, there's a notion of within the next few days even, putting some emergency additional funding behind the SBA programs, behind the hospital needs, behind the state and local government needs. So that's definitely part of what comes next. But then looking more broadly at issues that have come up that we need to solve. So for example, many states, localities, and the federal government in connection with certain kinds of mortgages and property owners have put moratoriums in place on evictions. But those go out maybe 3 or 4 months, and that doesn't include forgiveness of your rent obligations, for example. So if we don't design something that will come behind that and support people that are in a very difficult position economically, they could go off the cliff in 3 or 4 months. So that's a very present issue that we're focusing on. After all, if you're going to ask people to stay home as part of their contribution to solving this crisis, you should be doing everything you can to avoid a situation of evictions, people ending up homeless, and so forth. So that's an example of something we're looking at for the next round. And then, as you said, some infrastructure items. An example of that is putting broadband in place, or other projects that could help us address this crisis we're in now, but also begin to set the table for what the economic recovery will look like once we get past the health crisis. All of these conversations are happening. I have to tell you, I've been kind of amazed so far. We'll see how long this holds up, at the bipartisan nature in which these relief packages have come together and how quickly they've gone out the door. I think it's a recognition, frankly, that every community, every member of Congress, et cetera, is seeing in their district the impact, and moving quickly is the way you can help people get to the other side of this crisis. Now, it'll get probably more political as we go on, but for the moment, I think it's been heartwarming to see the collaboration that's occurring.
That's good. That's great. I mean, that's great to hear. And you're right. I mean, we're all suffering. We're all in this together. And, you know, there are main streets in Republican districts that are hurting just like the main street in my district. And so, you know, I appreciate that. A quick word on PPE, because people are, you know, one of the things that for some reason feels a little bit political is PPE and this deployment of PPE, and why the sort of White House, you know, hasn't really coordinated in a way that at least I would have liked to have seen. We just saw California, you know, say that they're going to buy, you know, millions and millions of dollars worth of masks, and they're going to start giving them to the other states since nobody in DC is doing that. Could you talk a little bit about, you know, your feelings on sort of the PPE shortage? And, you know, I last week volunteered and hundreds of people have been volunteering to go to make PPE for Hopkins in a warehouse in, you know, off Broadway Highway. It seems just totally crazy that this is where we are. But I'm just curious if you could talk a little bit about sort of the PPE shortage, and if you see any of, you see what's happening now, talk a little bit about that.
Well, this is a fair point for some criticism, I think, and critique. I mean, I'm not going to pull any punches when it comes to the administration, because I think fundamentally this begins with an attitude. And I just don't think the president's attitude about this is the right one. He's constantly looking to shift responsibility and blame onto others in situations where he should just step up and take responsibility and show leadership. And this availability and supplying of personal protective equipment and ventilators is a prime example of that. The president should be straight with us. He should tell us what's in the national stockpile and what's not in the national stockpile. He should tell us what the capacity of the federal government is to respond to states, but do it in a way that demonstrates that he wants to respond. He wants to be there as a partner, not as a critic, and not someone who's trying to sort of avoid responsibility. So unfortunately, that's the posture that the president has been in, it seems like, from the outside. I mean, just in the last couple of days, now he's trying to throw shade on the World Health Organization because he doesn't want to take responsibility for what's happening in his own administration. Now, as a practical matter, what's going on right now in terms of getting this protective equipment and ventilators is that states largely are on their own. Unfortunately, what that means is without the kind of broad coordination from the White House that you would like to see, the states end up competing with each other. Or in this instance, as you noted, some states that maybe are getting past their surge are stepping up and filling the vacuum that the president has created and saying, we'll get supplies and we'll ship them over to states that are in a tough situation. The president's failure to invoke earlier the Defense Production Act and to force the manufacture of these key supplies is another example of where, you know, it would have made a difference 2-3 weeks ago in terms of what was available to people. Now, if you talk to hospitals, yes, they continue to try to get these supplies out of the Strategic National Stockpile and national FEMA Federal Emergency Management Administration. That's not going so well. They're also sourcing them from state emergency administration. So, for example, there's a Maryland Emergency Management Administration. They've been doing their best to get hold of supplies.
Yep.
And then they're trying to find it just through their own supply chains. So it's a scramble. It's not pretty, and it will definitely be the subject of, a review after we get through this.
Yeah.
But in real time, we've got to try to find those resources wherever we can, and we have to be generous. And if we're not the state that's in the middle of a surge, or if we get past our surge ultimately, I think Marylanders are the kind of people that will step up and say, how can we help our neighbor, or this state, that city? That's the spirit of cooperation that we all want to project, I think, at this moment. And I hope our president over time will project a similar kind of spirit. But unfortunately, I'm not crossing my fingers on that point. We have to build out the network that's available to us and keep that strong, and try to provide supports to those who need it.
Thank you. Yeah, I mean, I've been so impressed and overwhelmed at how giving and amazing people have been in terms of, sewing masks and giving their time to make things. And I am sure, when we get through this, we will want to support our, fellow Americans as well. So thank you. I'm going to give you a minute to just make any closing comments you might want to make about where we are and where we're going, and just really appreciate all that you are doing to support Maryland, support the country, support the people of the 3rd Congressional District, and to make sure that we're getting the information that we need so that we can take advantage of the programs that exist that you're passing. So thank you.
Thank you, Brooke, again, for the opportunity, and thank you for the work you're doing for your constituents in all of Maryland, because in doing that work, you're helping the broad community for sure. I think I'll end with sharing a comment from Anthony Fauci, who was on a call that we had today, our caucus, with the White House task force, the coronavirus task force led by Vice President Pence. And Dr. Fauci asked us to explain to our constituents how this week and next week are going to be tough weeks, and how there's two kind of contradictory messages that are coming at the public right now. And being able to process those simultaneously, I think, is important for people. One is you're hearing that this is going to be a difficult week because we're going to see a significant number of deaths occurring this week from the virus. And obviously that can shake people. At the same time, you're beginning to hear a message that the mitigation strategy, where people are social distancing and following these other precautions, is beginning to pay dividends. It's beginning to look like that's having a positive effect. So in this same week, people will be getting information that says, hey, mitigation seems to be working, and that represents a little bit of light at the end of the tunnel. But also coming this week will be some pretty shocking statistics on some of the death tolls around the country. I think people out there have already demonstrated over the last 4 or 5 weeks their ability to juggle and process difficult messages, and it can be a roller coaster at times. Yeah. But I want to say to people, the precautions you're taking are making a difference. They really are. And I think Maryland, I give the governor and the General Assembly and our whole federal delegation working together, I think has shown real leadership here in sharing good information with the public. But the real leadership is coming from everyday folks out there who are implementing these precautions and following these guidelines in ways that are going to get us through to the other side of this crisis. So I want to finish where I began by thanking them, and of course thanking those who are working on the front lines.
Well, thank you. Thank you so much for joining us today. It's the first night of Passover tonight, and Easter is on Sunday. So I want to wish everybody out there, who celebrates a wonderful Passover and a very special Easter. This is certainly the most challenging time one of the most challenging times our country has ever faced. And just want to end on a note of gratitude as well for all the people who are on the front lines, the healthcare workers, but also our grocery store workers and our transit drivers and everybody who doesn't have the luxury from doing work in a basement, but are really out there on the front line. So ending with a note of gratitude and also a wish that all of you have a wonderful Passover and a very special and wonderful Easter. And thank you so much, Congressman Sarbanes, for all of your work and for joining us today. Take care. Stay well, everyone.